Welcome to the Patient Advocacy Show. I am Charndeep Sahota, along with our Patient Advocacy Club members and research team at Touro University California. Disclosure: the views shown in the presentation may not necessarily represent the views of Touro University. In this episode, we will discuss our Touro University California documentation guideline with attention to our 7th guideline, which reads, medical students should view health record documentation through the lens of all core competencies. The purpose of this community outreach video is to improve patient-provider communication in the clinical setting. In particular, we want information in health records to be accurate so patients are heard and understood, and also meaningful so medical providers can discover an accurate diagnosis and effective treatment plan for each person. In the description of this YouTube video, we include an IRB-approved survey. I invite you to watch this video and click on the link. We would like to know how you feel about these new policy changes with your answers and comments in the survey. Our second guideline reads, medical students should view health record documentation through the lens of all core competencies. Why is this important?
It is easy to view health record documentation as mostly a clerical task, but it is much more. By viewing health record documentation through the lens of all 7 core competencies, we have an opportunity to better serve our patients as healthcare professionals.
Okay, thank you. What are the 7 core competencies of the osteopathic medical profession?
The 7 core competencies, as recognized by the American Osteopathic Association and the American Association of Colleges of Osteopathic Medicine, are osteopathic principles and practice, medical knowledge, patient care, interpersonal and communication skills, professionalism, practice-based learning and improvement, and systems-based practice.
What is the purpose of the 7 core competencies?
The 7 core competencies serve as a framework to create medical school learning objectives, assess achievement, and demonstrate continual improvement in the educational process. In other words, it is what we expect osteopathic medical students to learn in school and practice as physicians.
Are these core competencies unique to the osteopathic profession?
Core competency, osteopathic principles and practice, is unique to the osteopathic profession. The remaining core competencies are the same as the 6 core competencies used by the American Medical Association and American Association of Medical Colleges.
Thank you. Let's start with the core competency that seems obviously linked to health record documentation. Please tell me how we should view health record documentation through the lens of patient care.
Patient care is arguably the prime directive of being a physician. The Annals of Internal Medicine called the purpose of health record documentation to retell the story. The patient's history, which is the medical interview, tells the patient's concerns, needs, and experience with the medical condition. The examination showcases what is observed during the patient presentation. Medical decision-making records the problems addressed, data reviewed, and risk taken to help the patient. When doctors or medical students document information into the health records, they are retelling the story, so everyone in the medical field can understand the patient's needs, what is being done, and what would happen next.
Thank you. Viewing health record documentation through the lens of patient care retells the story. How about viewing through the lens of medical knowledge?
Medical knowledge includes being aware of facts and concepts. For example, how do you identify uncontrolled diabetes mellitus, and how do you work with the patient to lower blood glucose levels? Health record documentation establishes a data set of the patient to apply medical knowledge. If the health record is accurate, for example, the patient's story is accurately told and laboratory data is available for analysis, then medical knowledge can be applied to determine an accurate diagnosis and an effective treatment plan.
Thank you. Viewing health record documentation through the lens of medical knowledge puts attention to the importance of accuracy. How about core competency, interpersonal, and communication skills? Why should we view health record documentation through the lens of this core competency?
Interpersonal and communication skills also highlight retelling the story in the health record. This core competency recognizes the need for physicians and medical students to view health record documentation as a communication tool, not just for medical professionals, but also for patients and caregivers.
Tell me about the impact on other healthcare professionals, and then please discuss the communication to patients and caregivers.
Sure. Health record documentation creates a longitudinal story of a patient's experience with health and disease throughout a lifetime. When a medical student or physician enters information into a patient's health record, The patient's medical story is being told. For the medical provider in the emergency department, the previous health record helps her understand the patient, which may have great bearing on taking care of the patient now. After the emergency department encounter, the doctor's health record note will guide other health professionals to continuously reassess the diagnosis and adjust the treatment plan. For the patient, health record documentation can include discharge instructions, which define the diagnosis and outline the treatment plan. Increasingly, we should expect patients and caregivers to read the entire health record after a medical encounter. This puts a high level of emphasis on interpersonal and communication skills.
Thank you. I like thinking about health records as a longitudinal story of a patient's life journey battling disease and seeking health. Osteopathic principles and practice is a core competency unique to the osteopathic profession. Why should we view health record documentation through this core competency?
Core competency, osteopathic principles, and practice include hands-on diagnosis, diagnostic maneuvers, and treatment procedures that are core to the osteopathic philosophy. Viewing health record documentation through this lens allows for the capture of physical diagnostic findings, such as somatic dysfunction, which can cause pain or limit function. Documentation can also capture what is done, such as osteopathic manipulative treatment or OMT, to reduce somatic dysfunction, which can reduce pain and improve function. In subsequent medical visits, health record documentation can also capture the patient's story in response to previous treatment. Did the procedure from the last visit reduce pain and the need for medication? Did the procedure from the last visit improve function and allow the patient to enjoy a better quality of life? Viewing health record documentation through this core competency offers a means of gathering outcomes data in the medical record.
Thank you. I like the concept of viewing health record documentation with focus on the patient's story to capture outcomes data. System-based practice is a core competency that many medical students may not often think of. It's one of the categories on the score sheet that attending physicians complete for a medical student on a clinical rotation. But what does it mean and how does it relate to health record documentation?
Core competency systems-based practice is all about why. Why do we perform certain duties and why are current policies in existence? Health record documentation policies for outpatient, office evaluation and management services, for example, just changed January 1st, 2021. Starting 2021, the physician payment formula is no longer linked to documentation of the patient's history or documentation of the examination. This does not mean that the history and/or exam are no longer important. New policies instruct medical providers to document the history and exam based on what they feel is medically appropriate. It is no longer the task of the provider to document a history based on how many questions are asked or the number of pages typed into the health record. Our government wants medical providers to focus on the patient and not be overly concerned with creating documentation volume in health records. Addressing why lets us understand why new government policies want health record documentation to focus on quality and accuracy rather than the volume of words.
Thank you. System-based practice addressed why. How about core competency practice-based learning and improvement?
Core competency practice-based learning and improvement addresses how. How do we deliver care? How do we uphold all the core competencies? And in regard to the new and emerging policies, how do we accommodate policies for the betterment of patients and all healthcare professionals? Practice-based learning and improvement includes research, biostats, critical appraisal of literature, and application to patient care. As referenced in our Touro University California documentation guidelines, health record documentation is highly inaccurate and incomplete. New policies, such as new health record documentation rules in the office setting, starting January 1st, 2021, call for patients to take an active role in co-authoring what is written about them in their health record. New rules are intended to improve the accuracy of health record documentation and make it more meaningful.
In light of new 2021 policy changes, such as removing documentation of history from the outpatient health record as part of the physician payment formula, Please tell me how we can accommodate and how it reflects health record documentation.
Individuals can accommodate by preparing for a medical encounter and answering standardized history questions before they meet with the medical provider. Medical providers can accommodate by simply following the new federal rules, which allow them to accept the patient's narrative. It is all about patients being heard and helping medical providers to understand the patient's needs, concerns, and experiences. I see new federal rules empowering patients to express their narrative and promoting patient-provider teamwork.
Thank you. I like the accommodation of patient's narrative and patient-provider teamwork to gather information. Kindly tell me how health record documentation should be viewed in the lens of core competency professionalism.
Core competency professionalism consists of behavior, respect, and work ethic. Health record documentation is a venue to capture the patient's story and retell the story in a professional manner. Effective health record documentation showcases professionalism when a patient reads her health record and sees that she is well represented. The same observation can be said when a nurse or a medical auditor or another medical provider, such as the physician in the emergency department, reads the health record. Documentation in the health record creates permanent quote-unquote material that represents professionalism of the medical student and attending physician.
Thank you. Health record documentation captures and showcases professionalism. Mr. Glenn Davis is an associate professor and director of curriculum at Touro University California. Mr. Davis, can you comment on the importance of viewing all activities, particularly health record documentation, through the lens of all 7 core competencies?
Yes, thank you. As director of curriculum at our medical school, I am a proponent of all 7 core competencies in what we teach and what we assess. Health record documentation is of particular importance because it is integral to every encounter that our students will have with patients. Whether being a medical student or an attending physician who has practiced medicine for many decades, health record documentation is part of the job represented by all 7 core competencies.
Thank you, Professor Davis. I appreciate viewing our 7 core competencies with a lifelong perspective. Thank you to all our panel members. I encourage medical students to view health record documentation through the lens of all 7 core competencies. I thank all of you for viewing this episode of the Patient Advocacy Show. I hope this episode helped you better understand new health record documentation policies and how they impact patients and medical providers. This community outreach message also includes an IRB-approved survey, which can be found in the description area of this YouTube video. I encourage you to participate in this survey. Our team will track responses and report results back to you in future episodes. Thank you for viewing, and we'll see you at the next Patient Advocacy Show.